Okay, so let's unpack this today. We're doing a deep dive into something really fundamental, but also kind of slippery. How do we uh, actually figure out if medical care is any good? Our main source here is a really foundational paper by Avedis Donabedian, republished back in 2005 in the Milbank Quarterly.
hmm
Just a classic,
Yeah.
still shapes how we think about quality.
Yeah, and what's fascinating, I think, is how Donabedian, right from the get-go, highlights that just defining quality in healthcare is, well, it's really difficult. It isn't some single easy thing. It often reflects, values and goals. What does the system value? What does society value? So our mission today is really to explore his three main ways of looking at it and the real challenges in trying to measure something this complex.
Okay, so three approaches. The first one Donabedian talks about is structure. Think of that as the sort of the setting, like the buildings, the equipment, the staff,
Hmm.
the qualifications, that kind of thing. The underlying idea, I guess, is you have good structure, good care should sort of naturally happen. But does it always? The paper asks that, right?
Exactly. That's a really key point. Structure is tangible. You can measure it relatively easily, but the link between, say, a fancy hospital building and whether you actually get better, well, it's not always that strong. Just because a hospital is accredited doesn't automatically mean every patient gets top-notch care. It's maybe necessary, but not sufficient, you could say. And this is where it gets really interesting because he then moves to process.
Right, process. So that's the doing part.
That's it. The actual delivery of care. Is the diagnosis right? Was the surgery performed competently? Is care coordinated? Does it continue over time? It's really asking, is the medicine itself being done properly, step by step?
And then the third one is outcome, recovery, how well the patient can function, survival. I mean, that seems like the most obvious one, doesn't it? Did the patient get better?
Outcomes are definitely the ultimate validators, yes. They matter most to the patient, for sure. But, and this is a big but, they come with real limitations. Donabedian points out, look, loads of things affect whether someone recovers, not just the medical care they got, lifestyle, social factors, sometimes just luck. And some important outcomes, especially for chronic stuff, might take years, even decades to show up. Hard to measure in the short term. Plus, and this is crucial, I think, outcomes tell you what happened, but not why. If things went badly, the outcome alone doesn't pinpoint what in the process needs fixing.
Which leads right into the next problem.
Yeah.
How do you even get good information to assess any of this? Structure, process, or outcome? The paper talks about how clinical records can be, well, surprisingly patchy, maybe incomplete, especially outside of big hospitals.
Mm.
And if you try watching doctors directly, there's that observer effect, right? Do people act differently when they know they're being watched?
Yeah, exactly. It's a bit like that restaurant critic example you mentioned earlier. Are you seeing the everyday reality? And these other methods, like asking doctors where they'd send their own family, useful insights maybe, but Donabedian notes they often lack external validation. They're still opinions at the end of the day. He also digs into the standards we use for judging. Are they empirical, based on what doctors actually do on average? Or are they normative, based on the best available knowledge, what should be done?
And there's a trade-off there.
There really is highly specific standards. They make measurement more reliable, sure, because everyone's judged the same way, but they might miss the nuance, the flexibility you need for complex individual patients. Healthcare isn't always cookbook medicine.
So bringing it all together, that's the big takeaway here. Donabedian's conclusion is pretty stark, actually. He says even with the methods we have, which might seem crude, they can show a huge range in quality, from excellent care down to really, really poor care. But real improvement means thinking bigger than just the technical side. We need to include prevention, the patient-doctor relationship, safety, and, yeah, even cost-effectiveness, getting good results without wasting resources.
Absolutely. And maybe the deepest point is shifting focus. Less about just judging quality after the fact and more about truly understanding the whole process of care first, like really knowing what goes on here before jumping to what's wrong.
Mm.
You need to understand the system to improve it. So here's something for you to think about, building on that. Donabedian cites this idea that maybe optimal care for the community might mean less than the best possible care for every single individual because resources are limited. If that's potentially true, what does quality healthcare really mean when you have to balance individual wants against what society can actually provide? What does that balance look like to you?